Welcome to the Acu Health NJ podcast. We are back featuring Dr. Michael Beys and Professor Dube. And today we are going to talk about one of my favorite subjects. How does acupuncture work in the real world? So, first effect, Greg, is? Local effect. So, the best way to describe this is when you cut yourself, what happens? Do you bleed out and die? No, unless you're a hemophiliac. But normally, the body has the ability to heal itself. So, very simply, we can apply that to a back, a neck, a uterus, or an ovary. There is something deeper, and we'll talk about that later, about the local twitch response, which is a high-level skill. It takes years to develop, which is critical. The second effect is the regional effect. So traveling up the nerve pathway, that's kind of like after we cut ourselves, we shake our finger. Ow! Why does that work? Movement overrides the pain signal. It's very easy to scramble it. Our body has the ability to shut it down. It's called the diffuse noxious inhibitory controls, or the gate theory, where we just block the signal in the nerve pathway. And the last effect is
distal.
Central. In the brain, we release endorphins. Endorphins further relieve pain, but also have this added bonus of cutting out cortisol, which allows your body to go into rest mode and reboot. So local, regional, central. We're going to say these over and over again. So we're going to set a baseline. We're going to create a glossary, because going forward, when we talk about how acupuncture can help fertility and back and recovery and all this stuff, analogies, we're always going to be referring to the local effect, the regional effect, and the central effect. And then there is a fourth effect, which was a whole episode of itself, the genomic level, but we'll save that for later. Or what you guys know is biohacking. Yes, acupuncture is biohacking. You don't have to jump in a pool of ice water. You're welcome. But let's talk about that. So this is something that we've accumulated, a narrative based on physiological mechanisms on how the body works. We're going to explain it to a sixth grader. But Greg, I'm going to pass it over to you and say, do we talk about this initially in school?
No, not necessarily. We have a different mechanism. It's the same last one as distal, but no, we typically don't talk about the central, because the Chinese had a different view of the brain. Like the central nervous system, as far as they're concerned, didn't exist the way that we think it exists. So they're talking about completely different things, more the esoteric stuff that, which leads me to ask you a question is, because this is such an unorthodox way of looking at things, how did you come upon this point of view?
I read an article in the British Journal of Medicine written by a doctor that basically spelled it out like that. And it made the most sense to me, because for the longest time we were told that there's this magical force in the universe that, flows through our body. But I think we both know, because woman Shuo Zhongwen Yidian, we don't know much about the Chinese language between Greg and I, but what we do know is that we lose a lot in translation. Mm-hmm. Okay, but I'm going to stop right there, because you mentioned something about the distal effect. Talk to me about that.
Oh no, distal is just like, there's something called Helton's law, which is like, as you know, that we have these different regions of innervation in our body, right? You have like the ulnar nerve will innervate this side, your radial nerve will innervate this side, the median nerve does this thing, goes down the middle, but then the fingers will like alternate between the radial and medial, like the back. And essentially the distal effect just says that that these nerves are all responsible for a patch of skin. And so when we put the needle in there, we start the local and regional effect. Mm-hmm. That effect distally travels to any region that's innervated, any patch of skin that's innervated by that nerve underneath. So mm-hmm. That's the distal effect. That's why, when people ask me, oh, why are you putting it in my hand for my nose? That's right. How that works.
Okay, good. I like that. Actually, we call that also treating transsegmentally. So if my knee hurts, right, I can treat my ankle, so I can start the healing process in, again, the region, right? Yeah. I think it's a kind of like a synonym or a paired statement. So we don't talk about that in school. We do, over the course of time, get exposed to literature, as we're supposed to do, is like read into the subject, and we kind of come up with new things. And the one thing that I would say that was the most profound in doing work is to say that somebody just put it down on paper and said, acupuncture can be correlated to physiological mechanisms. And why is that important? Because I had a teacher way back when we were studying. We have when we talk about traditional Chinese medicine, there is a theory called Zang Fu, and it's based on how the classics, or the time that it was practiced, that's their jargon and narrative. And what the teacher said is that if you understand disease and you understand how organs work, then you can reverse engineer pathophysiology, right? So, when we launch and we talk about other things going forward, we're always going to be using these physiological mechanisms to say this is how acupuncture works according to the ideas of modern physiology. Because, granted, it's very exciting, it's very esoteric and philosophical, but most people just want to get better, right? They don't care how it works, but they'll start to ask you when they come on board.
Yeah, and what people have to understand is like we're not necessarily discounting the original view of Qi and everything else, but people have to understand that that's a very loaded and a very intensive study for somebody to get involved with just to understand medicine. If there's an easier way we can help our patients understand it with language that they're generally more familiar with, Western physiology, and using those terms, right? It's a lot easier for a person to understand, relating to the universal experience of how acupuncture works with you fell and you cut yourself, rather than invoking things like Qi, three treasures, Jing, Qi, Shen, right? Because that's remote from the experience, as opposed to, we can very accurately describe acupuncture's mechanism by just talking about the healing mechanisms that happen when their child falls or they fell, right? Mm-hmm. I feel like because it's less alien and less remote, it doesn't require so much esoteric and woo-woo study. I feel like this is just a more practical approach because it helps people understand. And one thing that we do know is when people understand their treatment,
yes,
they have better results.
What we say, communication, internalizing. We bring the patient on board and explain. I always go over these things because I want people to understand what we're doing. And we don't want to ever be in a state where we're holding like a what we call ancient Chinese secret, because that was the language of the time. Yeah. And now, even if those ancient masters had the tools that we had today, like microscopes and MRIs and things like that, they would totally be on board on using it. So it doesn't have to be over there, it doesn't have to be over here, but what it has to be is able to communicate to the patient so that they know what's going on, instead of us just poking them with needles. They're not needles, they're filaments.
And that's why we're doing what we're doing here. So
exactly.
We can make sure you give people understanding, because there's one thing that I get told that I hope after this podcast I'll stop hearing, which is after the second or third time people say, "Oh my God, acupuncture actually works." To which point I go to them like, "Oh, you thought I was just scamming people for a living?" So I feel like explaining these things to people and bridging that communication gap will help people be less surprised and kind of like expecting to get better, right?
Yeah. Yeah, well, that's the whole thing is like, so one of the things that I get to when you say, "Oh, I can't believe acupuncture works," is I get people, "What do you do for a living?" "I'm an acupuncturist." "Oh, I hate needles." So what I will say to them immediately is like, I don't use needles, I use filaments. And right there, what we're doing is we're eliminating that primitive mechanism that's stored in the brain that can be applied to your back pain, your headaches and stuff like that. So what a needle is what your pediatrician stabbed you with. And if you're gonna allow that to get in the way of experiencing relief and ultimate care, then we have to change the definition and call it a filament, because we getting into the brain and seeing where that old pain mechanism is, where your pediatrician stabbed you with, we need to get over that and get people on board. So it's a little bit of a Jedi mind trick, but it is about accessing that central mechanism and changing how we perceive pain in the brain.
Absolutely. I agree.
One of the other things that we want to talk about is the local twitch response. One of the things that we do is we deactivate the motor end plate. What does that mean? Muscles have a protective mechanism. When you get injured, their job is to kind of seize in place to protect joints. So when that guy goes to pick up the tool off the ground and throws his back out, the muscles will leash around the nerves around the spine and create spasm. And it's so intense that it seems like they need to take a ride to the emergency room. But the emergency room really can't do much for them. So what we do is we get in there and we unlock the muscle. But that is what, again, crossing over the ancient and the current, is that in the ancient texts, when you needle somebody or you do the acupuncture, it should be like a fish biting a small hook. Mm-hmm. So we know that's where the skill lies, is to be able to do that. Mm-hmm. What is your experience with trying to accomplish that?
The Qi, at least with my students, they ask me about that all the time, because there's a lot of conflicting information, and this is a little bit of inside baseball for most of you out there, but some of my students ask me, "Oh, am I supposed to feel it? Is the patient supposed to feel it?" And there are actually traditions that say both, but in terms of that specific response you're talking about, like especially when the muscle's like super pathological, you can sometimes you touch it and it will go, right, or on the insertion. But you know, I've actually had before coming here, you know, I was experimenting, like there's a more subtle the chi sensation where like it kind of grabs the needle. That kind of exacerbates when we get that like more dramatic response. But I've definitely noticed since like we've been incorporating it more, I've definitely noticed a difference in, you know, the dramatic shift that people have. It happens much quicker. I feel like without the twitch response, it's a gentler but longer period it takes for them to recover, as opposed to that twitch response. Though it is a little bit surprising for some people, it does, but not painful. Just like they're just, oh, what's that? But then like they tend to get a more rapid.
Right, but we're going to communicate that to the patient. We're going to tell them what to experience, and this way they're ready for it, so that, again, we're always onboarding the patient to what we're doing. But getting back to fishing, when you get that really, really nasty, wound up, tight, angry muscle, and when you get it in there, and you feel that, and you see, when you say the patient experiences, but you can see it, I think is the most gratifying thing about performing acupuncture, and it's like nailing that big trophy game fish when it comes out of the water, that breach. So to use a fishing analogy, it is important for the patient to experience and for you to see it, but I will say this, it's more present in hips and shoulders and upper backs than it is, say, in a lumbar area with deeper muscles. It's harder to see. And it's always good to ask, did you feel a twitch? Did you feel something? And getting that feedback. Because you don't always see it, but it is critical to the to ultimate relief.
Yeah, one thing that's interesting about the way you do it, because, you know, as a teacher, right, you have to let your students do it. You're in the clinic, right? And like I'm recently removed from being like in school, so like I remember having people try. My classmates were good. Nobody really hacked them to death. But one thing that I noticed that's different about you, which is, you know, even though my classmates were good, like you're even like more painless, is we were taught to do it quickly. Right, and you do it a little bit slowly. You talk about that, because, you know, that's something that maybe patients with acupuncture might not be used to.
So all you Dune fans out there, we say, or I use the analogy with Greg, is like the slow blade penetrates the shield. So slower, because even for me, when I'm trying to tune myself up and work on my hips, when I go in there and it's not there, if it's not there, it's not there, and we have to move on. But sometimes I feel if you just slow down a little bit and let it get through the fiber, it almost just kind of comes to it automatically. And it's not something, I mean, we can correlate it to a physiological mechanism. We've seen the phenomenon done in EMGs. That's how I first found out about it, is like some EMG doctors will say, we'll get the muscle to twitch. But it is definitely a big piece of the puzzle, and ultimately, you know, where we get our best results, quicker, faster.
Absolutely.
But I'll be full disclosure, this came over 20 years, right?
Absolutely.
We were just kind of stumbling in the dark early on, but it is definitely, it's critical.
But at the same time, that 20 years is why people can come to you like with confidence and knowing that they're in good hands, because, you know, you're doing the research, right? You're not sitting here saying, oh, I've been here for 20 years, I'm resting on my laurels. You're still learning, you're still engaging with disciplines that, quite frankly, not a lot of people in our field are engaging with, like the genomic stuff, which you'll hear about more, stay tuned. But like things like that, so it's like, I feel it's good for them to hear that, like what's developed over 20 years, because, you know, let's face it, sometimes people walk in here, they don't understand what they're getting, the value, right? Like, you know, they tried the rest, now they tried the best, right?
Yes.
And so that's what we tell you guys. You try the rest, you try the best. If you even haven't tried the best, you just try the best with us.
Well, thank you for saying that.
Of course.
We want to remain humble, but the other thing too is
we
like,
want to remain factual as well.
Yes, of course. But one of the things I like to think is like, why didn't somebody show me this like 20 years ago? And one of the the grateful things of practicing is to be able to share some of this experience with somebody other than your patients. So thanks for hanging around and
of
dealing
course,
with us.
there's a lot to learn.
But all right, so we're going to wrap it up for today, and I think we formed the baseline and a glossary for going forward, and we're going to launch into some more interesting and relevant topics about what we see in the clinic. So thanks for joining us, and don't forget to make an appointment. Call to action.
And like, comment, subscribe. We want to hear what you think. We want to hear your engagement, especially you ladies. You know, we're here for you, whether you're trying to conceive, you have menstrual issues, going through menopause, or other issues. Let us know what other issues you're having so we can look into them and give you some guidance. Take care.
Good.
Yep.
We got it live?
Yep.
Okay, cool.